This is an anatomy question. The nasolacrimal duct opening is located. Answers were given in the middle nasal meatus, in the superior nasal meatus, in the inferior nasal meatus, in the medial wall of nasal cavity, in the sphenoethmoidal recess. Each nasal cavity has a floor, a roof, a medial and a lateral wall. The roof of nasal cavity is formed anteriorly by nasal spine of frontal bone and nasal bone, centrally by cribriform plate of ethmoid bone, posteriorly by sphenoid bone and palatine bone. The medial wall of nasal cavity is the mucosa covered surface of thin nasal septum. The floor is formed by hard palate, and the bony support for the lateral wall is given by ethmoid bone, palatine bone, sphenoid bone, lacrimal bone and maxilla. The lateral wall is characterized by three curved shelves of bone, the concha, which run one above the other and project medially and inferiorly across the nasal cavity. These concha increase the surface area of contact between tissue of lateral wall and respired air. The concha divide each nasal cavity into 4 air channels: superior nasal meatus, a middle nasal meatus, inferior nasal meatus, which lies between inferior concha and nasal floor. The last one is sphenoethmoidal recess, which lies between superior concha and nasal roof. The opening of paranasal sinuses are on the lateral wall and roof of the nasal cavities. The lateral wall contains nasolacrimal duct opening into inferior nasal meatus, which drain tears from eye into nasal cavity. The nasal cavities are innervated by olfactory nerve, facial nerve and trigeminal nerve. The olfactory nerve carries olfaction and general sensation of nasal cavity carried by trigeminal nerve, anteriorly carried by ophthalmic division of trigeminal nerve and posteriorly carried by maxillary division of trigeminal nerve. And facial nerve carries parasympathetic fibers to nasal gland, which join branches of maxillary nerve in pterygopalatine fossa. The nasal cavities have good vascular supply to allow them to alter the humidity and temperature of respired air. The vessels form extensive anastomosis with each other, particularly in the anterior region of medial wall, where there are anastomosis between branches of greater palatine artery, sphenopalatine artery, superior labial artery and anterior ethmoidal arteries. This area is known as little area or Kieselbeck area. This area is the major site for epitaxis. When we come to the question where they are asking the nasolacrimal duct opening, the answers were given superior, middle and inferior nasal meatus, sphenoethmoidal recess and medial wall. So the answer would be inferior nasal meatus.